So let's begin this bulletin from the Supreme Court, which is hearing the 2020 election petition. Now, the 2020 presidential candidate of the NDC, John Mahama, has filed an application asking the Supreme Court to review its decision to disallow him from asking the Electoral Commission questions at the ongoing hearing. Lead counsel for Mr. Mahama, Chachu Chikata, informed the court about the filing of the application. In this new application, Mr. Mahama is asking for a review of the ruling on the application for interrogatories after the court dismissed the application for interrogatories. The court has also set 5 issues for determination, which include whether or not, per the data available, any candidate obtained more than 50% of the vote cast.
Reasonable course of action. 2, whether or not, based on the data contained in the declaration of the first respondent and the second respondent as president-elect, no candidate obtained more than 50% of their valid votes cast as required by Article 63, Clause 3 of the 1992 Constitution. 3, whether or not the second respondent still met the Article 63, Clause 3 of the 1992 Constitution threshold by the exclusion or inclusion of the Techiman-South constituency presidential election results. 4, whether or not the declaration by the first respondent dated the 9th of December 2020 of the result of the presidential election conducted on the 7th December 2020 was in violation of Article 63, Clause 3 of the 1992 Constitution. 5, whether or not the alleged vote pardon and other errors complained of by the petitioner affected the outcome of the presidential election results of 2020. By virtue of the powers vested in this court under Rule 5, Sub-Rule 4 of CR 99 to dispose of this petition within strict timelines, the following orders are made accordingly. 1, mode of trial. The petitioner and the witnesses shall file witness statements with exhibits, if any, by noon of Thursday, the 21st of January 2021. 2, the witness statements shall be served on the counsel for the respondents by the close of the day of Thursday, the 21st of January 2021. 3, the respondents and their witnesses, if any, shall file their witness statements with exhibits, if any, by the close of the day on 22nd January 2021. 4, the first and second respondents shall file their submissions on the preliminary objections raised to the petition by 12 noon on Friday, the 22nd of January 2021. 4b, the registrar shall ensure service of the submissions of the preliminary objections by the close of the day on Friday, the 22nd of January 2021. C, the petitioner shall file any response to the submission of the preliminary objection by noon on Monday, the 25th of January 2021. D, the registrar shall ensure service of the petitioner's response by the close of the day on Monday, 25th of January 2021. E, ruling on the preliminary objection will be incorporated in the judgment of the court. Timelines. The court shall sit on Tuesday, the 26th of January 2021 for hearing of this petition.
My lords, we have just heard the orders that you have made. We thought that part of the hearing this morning was in effect to enable us to make representations on the various things, but it looks like your lordships have made certain orders, and there is some degree of unclarity, at least in our minds, as regards what is referred to as a preliminary objection. Because, my lords, there are, in the 2 answers, there are a number of different things that are referred to. I'm actually not clear.
Of the preliminary objection. The issue to be determined as preliminary objection. That has been set out as read by the president of the court.
Well, perhaps we could hear it again because it was not.
Is whether or not the petition discloses any reasonable course of action. That's it.
Of course, we'll continue to bring you live coverage and updates on this ongoing petition. Two babies have been rescued and a baby trafficking syndicate busted after a collaborative investigation by IOCO and the Medical and Dental Council. 11 suspects, including doctors, nurses, social welfare workers, and traditional birth attendants, as well as mothers, are currently in custody, aiding in investigations. My colleague Manuel Coranting was embedded in one of the operations last year. Here's his report.
It's 7 a.m. on the morning of 31st December 2020, the last day of the year. As many people prepared to bid farewell to one year and welcome another, somewhere at the Tema General Hospital within the Tema metropolis, a baby was about seeing the last of his biological mother. In motion on that fateful day was the sale of a 1-month-old baby boy by an organized baby selling cartel. This syndicate is made up of several people, including doctors, nurses, and social welfare officers, among others, all of whom are entrusted with the responsibility of providing assistance to mothers and their newly born babies. Their operations had been on the radar of the Medical and Dental Council for a while, and today the council has teamed up with the officers from Economic and Organized Crime Office (IOCO) to foil one of such illegal transactions. The Connect, Leonard Able, an officer at the head office of the Department of Social Welfare, had already taken 10,000 Ghana cedis as a deposit for the baby, who he was selling at 28,000 Ghana cedis from a woman in need of a baby, not knowing she was an undercover officer with IOCO. The Joy News team was embedded in the operation and filmed from a distance as Mr. Able went to collect the baby and accompanied the female undercover officer to a vehicle. This was the point of arrest. Leonard Able was arrested and the baby retrieved. On-site interrogations revealed Mr. Able was not alone. His accomplices, a nurse only identified as Nancy, and the head of the social welfare at the hospital, also referred to as Auntie Doris, had heard of the arrest and immediately bolted.
I've called her several times, but she's not picking up, so I keep on calling. I don't know what to do.
What is her name? What is her surname? There's a woman who left in a car, in a taxi.
She left in a taxi?
Yes. They gave money that I should go and pay them.
Okay,
so
what's
later,
the evidence that you paid?
Oh, so the woman said that.
Which woman?
Nancy said that she had done adoption before. And she said that she had somebody, she has a baby, an abandoned baby here. Doris said she had an abandoned baby here. You get me? So I should assist her in the baby is there. Somebody, if they have somebody.
Not even a call from the medical director of the facility could get them to return.
Can you come right away to my office? My general hospital, director's office. Yes. 1 hour's time.
The entire morning went by with the arrested suspect pleading for mercy as he sent the team on a wild goose chase from one facility to the other in search of his other accomplices.
Yes, but the way my name, my this thing, I beg you. Help me, I beg you.
Yes. So
help me.
I'm asking.
Can you go help me?
They give you money? They give you money? Did you take any money?
They gave money that I should go and pay them.
Okay.
The day ended with one arrest as the task force worked at the leads to effect more arrests.
Manuel Coranting's report there, disturbing. Now, 72 hours after the president directed the IGP to deploy men to enforce the COVID-19 safety protocols, There seems to be no sign of implementation, as popular markets and lorry stations in Accra are yet to see the full enforcement of the directive, even though some 97 people were arrested on Tuesday. Joy News paid a visit to Accra Central earlier today, and Kweku Asante gave this report.
So it's a bustling morning here at the Kwame Nkrumah interchange, popularly referred to as Circle. A number of people, students, parents and workers alike, going about their normal duties. You could see a number of students about to pick vehicles to their various schools across the capital. Parents are also, some of them, sending their kids to school, and then workers also going about their normal duties. Of course, just as is very popular with Circle, you would see a number of hawkers as well as traders selling their wares or displaying them just by the street. But one thing that has become topical subject of national conversation is the issue of wearing of face masks, as well as the adherence to the COVID-19 protocols that the government has put in place to limit or stop the spread of COVID-19. And so in the president's 22nd address, he said that he has given the police the authorization to go about and arrest people who do not adhere to the COVID-19 protocols, wear their mask and adhere to social distancing. Yesterday, the police arrested a number of people here in Accra because they were not wearing their face masks. And as part of the fines that you would pay close to 12,000 cedis. You could spend a number of years also in prison in default of that. And so we are here in Accra Central or Circle to be able to gauge how many people are wearing their masks, how well they are wearing them, and also if they are ready to pay such fines if they are arrested for not wearing. So let's speak to some people around who are going about their normal. So let me see if I can speak to this lady. Hello, madam. Hello. Please, can we speak to you, please? Yes. Please, what's your name?
Maud.
Maud. So Maud, the president has said that he's giving the police, the right to arrest people who are not wearing their face mask. This morning you are not wearing your face mask. So you have it in your bag, eh? All right, so you have to put it on, okay? But should the police meet you and arrest you, are you going to be able to pay the 12,000 cedis fine that they say? 12,000 cedis. You can't pay that?
No.
Right, so you put on your mask, okay? All right, Maud, thank you. So Maud, not wearing her face mask, but she has it in her bag, but she's going to put it on, and the idea that she has to cover that up. Hello, we are trying to gauge some people. Can I have a brief word with you, please? Yeah. Yes, so in terms of the wearing of face mask and all, the president says you are going to arrest people and charge them, fine them and all. Do you think this will be a deterrent enough for those who are not wearing their masks?
Because most Ghanaians don't like to do these things on their own, unless they are forced to. You see, I was watching news this morning, I saw Kasua Market. Almost all of them are not wearing nose masks. So imagine if the police are there, I'm sure that they'll wear it.
So why do you think people are not wearing a mask? Because there are people, some of them have their mask is in their pocket or is in their bag. What at all is accounting for this?
Do not believe that the thing is real. Some people think it's just a way that people are using to just frighten them. So they don't believe in it. You see, so if somebody doesn't believe in something, it's very hard for you to enforce this thing on them. See, if they believe in it, you don't even have to bring the police in. They'll be doing it of their own will. But because they don't believe, imagine you say somebody will buy the mask and put it in his pocket. It doesn't make sense. Why do you buy a mask and put it in your pocket? It's supposed to be worn, not in your pocket.
So just like you said, some people do not believe at all that the corona is around. Yeah. Personally, do you know anybody that has contracted the virus around you at work or anything for that?
Yeah, I know some of my workers were infected with the virus, but fortunately none of them died. But they were isolated for some time. So I believe in it.
I'm grateful, sir.
I even have about 2 or 3 man.
Right. Thank you. I'm grateful. So, this gentleman here giving us some perspectives to this, saying that some people don't believe in the virus, and that is why they are not wearing the face mask. Hello, sirs, can we have a brief word with you, please?
Come in again.
Can we have a brief word with you regarding the wearing of face mask? The president is saying that if they get you and you're not wearing a face mask, the police should arrest you and all. Do you think this will work on the people and it will force them to wear the mask and all?
But your life is your own. It is in your hand. The president said that you should wear the face mask. Why he say that? Because of the COVID-19. Like it don't be COVID-19, no go mandate that everybody should wear the COVID-19. I think everybody must wear it.
Yeah, so why do you think people are not wearing it? There are people sometimes they have it, they are not wearing it.
Even me myself sometimes I not wear it, but if you enter the place where I enter the public place, like the circle like this, I have to wear it because people are plenty. Somebody can call, somebody can do anything at any moment. So you have to prevent yourself. Yeah.
But you think that the arresting and prosecuting will deter people, it will force people to wear the mask, it will help?
No, better that you let the people should understand it. If the people understand it, then I don't think that they will force them.
I'm grateful.
Yeah. Now, there's been another significant increase in COVID-19 cases in Ghana. Severe cases rising by nearly 100% and critical cases up by 177%. There have also been 6 more deaths. The country's active cases continue to rise. We have details of this shortly. First, though, 4 of the country's nurses at the front line in the fight against the pandemic have succumbed to the disease, and that is according to the Ghana Registered Nurses and Midwives Association, which says many others are currently battling for their lives in health facilities across the country. The association on Tuesday issued a statement indicating their concerns. It reads, in part, "The world at large is battling the deadly COVID-19 virus, and the increasing number of cases in Ghana within a short space of time is a worrying development. The Ghana Registered Nurses and Midwives Association, GRNMA, having observed recent happenings in the country, wish to put across the following. 1. Total disregard for the COVID-19 protocols by majority of Ghanaians. Majority of Ghanaians are not observing the protocols, especially the wearing of face masks at public places, which is a worrying trend because it exposes everyone to potentially picking up the virus from infected asymptomatic persons. Considering that there are already imported cases of the new variant in the country and the possibility of its existence already in our communities, the non-adherence to the protocols will in no time result in an escalation of new cases which will overwhelm our already fragile health system. GRNMA therefore calls on all and sundry to adhere strictly to the COVID-19 safety protocols to safeguard the health of we, the health workers, and everyone else, which will ultimately save government the resources required to combat the pandemic on a large scale. 2. Breakdown of routine protocols at health facilities in the country. Measures that worked for us in the first and second quarter of the year 2020, such as pre-triaging, triaging, enhanced testing, and contact tracing, have been virtually abandoned in most health facilities. We call on all managers within the Ghana Health Service, the teaching hospitals, CHAG facilities, and other health facilities, both public and private, to reinstate the temperature checking of all those who enter the hospital premises, hand hygiene protocols, pre-triaging and triaging of patients, and the identification of quarantine and isolation areas. 3. Infections among nurses and midwives. At the peak of the first wave in July 2020, 840 nurses and midwives had been infected and 2 deaths had been recorded. The death toll now stands at 4, with the recent demise of Mr. Solomon Nso, a senior staff nurse who worked at War Memorial Hospital in the Kasana Nankana municipality of the Upper East region. A number of the staff currently infected with the virus are nurses and midwives, and there is therefore the need to test all staff at the hospital and proper measures put in place to quarantine and treat those infected. Contact tracing should also be initiated to identify those infected for treatment. Personal protective equipment is point number 4. The need for personal protective equipment, PPEs, will always be there as the pandemic rages on. We therefore call on government, as a matter of urgency, to boost the stock of PPEs for distribution to facilities at all levels to enhance the safety of health professionals. The full details of the statement are on myjoyonline.com. You can check them out. Now, for over a year now, the country has been battling the deadly coronavirus pandemic, which has cost more than 350 lives. The majority of these deaths were, however, said to have been as a result of underlying conditions, especially among the aged. And it seems many young people consider the virus a preserve of the older people. But recent data shows some young people who are without underlying issues are in critical condition due to the virus. This shocking revelation has left the youth disturbed and gripped with fear. Judith Awochetano has been interacting with some youth about this revelation and has more in this report.
Again, according to statistics from the Ghana Health Service, the considerable number of persons who are severely ill are surprisingly relatively youthful persons with no previous underlying health conditions.
That's the President, Akufo-Addo, during his 22nd address to the nation on the COVID-19 pandemic. The latest deaths from the virus seem to be sending shivers down the spines of many. It has been confirmed that many people in critical condition are young and are without underlying health issues. Meet Lois Bedo-Nkansa, a 21-year-old student of the University of Ghana who was very disturbed about the virus.
So it makes me really worried to leave the comfort of my home, to be in such a big place where I'm at risk all the time, sharing a room with someone in the same dorm, on the same floor. The possibilities are endless with how quickly and how seriously you can get the virus. You can die. Like, it's very mind-boggling.
She admits the hikes in cases should be a big worry to everyone, including young people.
You see, at first, I actually thought that I don't have any underlying problem that could trigger me dying from COVID. But now you don't even need anything to die out of this new virus, this new strain of virus, and it's really scary.
For her, coping with the virus in school has been more than a hurdle.
We can't see the virus, we can't feel it, we can't touch it, but it's there. So you always, like, your life is now pinned to the nose mask, and it's really uncomfortable having to sit with it, studying all night, all day. It's uncomfortable, and all the activities that made school fun have been taken out of the picture all of a sudden, like in a flash. Everything is gone. The drink cups, the social gatherings, like the fun of university life has been cut off so suddenly.
Some others have expressed concern about the way the youth in Ghana have taken the virus for granted. They say they are doing all they can to prevent the deadly virus from shortening their lives.
It has always been scary. We just have to protect ourselves and just follow the protocols. Because as at now, everybody can get in contact. You don't even know who, even the person you're talking to, whether the person is safe or not.
I think in Ghana it's much scary now because you see a lot of people dropping their guards. They are no longer wearing, you sit in the church hall and you see a lot of people no longer wearing their masks and all of that.
It's really, really bad because most of them were thinking that like it only affected the aged, but as it shows right now, that's false. And then I think the youths really need to get educated.
The big call on all is to mask up because COVID-19 is now no more respecter of age. Judith Awochetano's report for Joy News.
Let's do some other stories. Now, schools typically have one headmaster, but in the Nkekandi A Primary and JHS in the Awin municipality of the Western North region, they have two, Felicia Tichi and the Rain. Felicia Tichi runs the school for some 7 months and the other headmaster, the Rain, takes over. And it's because this is a school under a tree, well, under two trees. Correspondent Natalia Kwanzaa spends a day in this school and has come through with this report.
My staff and I have met to make some pavilion to help the students, because during rainy season, these students will come to KG class. You have to close. You can't teach anything.
The blackboard is crucified between the two trunks, and the students, over a dozen, have to share their concentration between the teacher and passerby. A teacher told Joy News.
Looking at the nature of the classroom too, we don't have a class, so we are sitting under trees to learn. So that is also another thing. Anything passing by, the people attention will be drawn to that particular thing that is going through.
These peoples are being thought to compete with elite system of education in big cities for a place in secondary schools, for a place in future, a place in a knowledge-based, skills-driven, globalized world. Let's find out how this process of knowledge acquisition is going on. Today, I joined the ICT class. It can easily pass as a kindergarten drawing session. The teacher draws and shades a mouse, challenging the imagination of the pupils to make what they think of it.
This round one is scroll wheel, all of you. Scroll wheel. Scroll wheel. So this is the left click and the right click. Is that okay? Yes. So when you want to do double clicking, you just put your 2 fingers here, like this. You place it back to listen to the sound of what? Of the mouse. So when you do it once, it is a single clicking, all of you.
In big cities where electronic waste chokes the environment, these peoples do not even have the benefits of a broken down computer system as an aid. In this farming community, the students know a whole, but a CPU may be too much to ask.
We should have gathered the material to let them feel it, that this is what a mouse, this is what a screen, this is what a keyboard. But here's the case, we don't have the materials here. So it's just that I'm just demonstrating it on the board for them to know how to. So whenever they meet it somewhere, they will be able to identify that this is what the teacher was talking about.
I feel sad, a class 4 pupil who spoke to Joy News. He put his English sentence together carefully, even cautiously, until a few stuttering. He decides his local language will help him make his points faster and better.
I feel sad. I come from Masenko, but I came to school at here. School need the chance in Passe. Say so to nso ni egu class mu a yenya baby ntina ponsu ya de ena class 4 me class 4 nso ya te aduana se.
A few meters away, a school block sits ingloriously in rooms. Roof is irredeemably perforated to live up to its task of shielding the peoples from bad weather. The once cemented floors are now dugouts and receptacles for small pools when it rains. Crevices in the walls are home for geckos, insects, and the doorway has no door.
There is KG 1 and 2. Yesterday we are here, we saw a scorpion came to our class, and even look at the board.
In Athalia Kwanza, Joy News, Western North Region.
Delta Paper Mill Limited, manufacturers of Flora facial tissue, have launched a back-to-school health awareness campaign. Now, the campaign seeks to educate children on the best health practices, even as schools reopen amidst an increase in COVID-19 cases. Their marketing manager, Barbara Inkum, says their target is to reach out to 50 schools in 4 regions. Faustina Safo interacted with her. Here's her report.
A recent surge in COVID-19 cases has got many parents worried about the safety of their children as schools reopen across the country. Already reports of pupils flouting basic safety protocols have dominated local media reports 2 days into the new school term, pushing the National Inspectorate Board to serve notice it will begin shutting down schools that fail to ensure their pupils adhere to the safety protocols. Stakeholders agree sensitization efforts must be intensified, especially at the basic level, to ensure compliance, but the government cannot do it alone. Delta Paper Mill Limited is therefore hoping its back-to-school health awareness campaign could complement the state's efforts. Pupils at the Carnation Bishop 1 and 2 were among the first batch of pupils who received training. Their target is to reach out to 50 schools in 4 regions. Barbara Inkum is marketing manager for Delta Paper Mill Limited.
Delta Paper Mill, we produce tissue products. And we know that tissue is one of the things you need to keep safe in this COVID period. We produce disposable handkerchiefs. They are in small packs that you can put in your purse or your bag. And we thought that at this time it's important we give some to school children so that they can use it in school and be safe. We are doing this just to help government because we know that government is trying to keep our children safe in school. Government alone cannot do it all, and since we produce tissue, we just decided to do our bit to support government in this initiative.
The group also donated facial tissues and disposable hand towels to teachers and pupils. Headmaster of Carnation Bishop 1 and 2, while applauding the effort, urged corporate Ghana to emulate the gesture.
We are saying that we are grateful unto you, because the donation has come at a time that we need it. And we are going to make good use of it. We are going to make sure that the beneficiaries, the students and the teachers, benefit from it. We are saying that this donation has come to augment whatever the government is providing. So we are so thankful unto you.
Some of the pupils pledged to observe the safety protocols, though they admit adherence has been difficult.
At first, we sit at 2, but now we have bring social distance. Sometimes we sit at 1. But if you come to school, we come around 6:30. But if you come, we wash our hands, we sweep and do all things, and use sanitizer. We enter the classroom, but we have Veronica bucket too. Then we get inside. So we thank God that they are bringing us this, but whatever they have said, we will do it for them so that we will all abstain from COVID-19.
And fellow Ghanaians, let's stay away from coronavirus, and we should take the rules from the government so that we can protect ourselves.
Faustina Safo for Joy News.
You're watching News Today with me, Kujo Yangson. Stay tuned for business updates.
Hi, good afternoon. Welcome to Business. My name is Darryl Kwao. Ghana has strongly objected to British Airways' plan to move its London-Accra London flights from Heathrow to Gatwick Airport. Ghana, in a letter to the British carrier, rejected the plan after the Aviation Ministry was informed of the intention to switch airports this summer. According to the ministry, it wants the decision reversed. Here's more.
At the end of the day,
the Aviation Ministry has, in a circular, rejected the announcement by British Airways to switch London-Accra London services from Heathrow Airport to Gatwick Airport. What this means for Ghanaian travellers to the UK is that all London-Accra London-bound BA flights will originate and terminate at the London Gatwick Airport. This starts in the forthcoming summer of June. The ministry has revealed that British Airways went ahead with this move without any consultation with Government of Ghana. To this end, the Aviation Ministry has begun discussions with British Airways to rescind their decision, calling on the airline to, quote, respect the position of the Government of Ghana and uphold the mutual interest of both countries, unquote. Meanwhile, we await the response from British Airways and Government of Ghana as discussions begin on this developing story. I'm Charles Aite for Joy Business.
Well, Charles Aite bringing us that report. KK Appiah is member of the Aviation Sector Advisory Board at the Ministry of Aviation. He has been speaking to Joy Business about Ghana's position on British Airways plans.
The day, the answers that they gave us were based on research that they claim that they have done, which subjected Ghana being moved to Gatwick from Heathrow. We also asked them to provide us with evidence of this research, which would substantiate their decision that they made. We asked them at the end of the day if they had also subjected Nigeria and any other African state to this move, and their answer was an equivocal no. So Ghana is the only country that they're moving to Gatwick from the British Airways terminal in Heathrow. Based on that, we thought that the evidence that they were giving us was not adequate enough. We've asked them to provide us with other information, which they have not done so at this point. And as such, we cannot accept such a change, which would inconvenience a lot of Ghanaian travelers who were going to the United States and other points thereof.
In other news, the cedi will be fairly stable against the dollar this year. That's assurance from the Bank of Ghana. This is despite some projections it would rise by a significant margin against major trading currencies. George Rafe has been engaging the regulator and has more in the following report.
Assurance follows projection by the Economic and Finance think tank, that is the Center for Economics, Finance and Inequality Studies, that the local currency will face some challenges this year after enjoying some firm stability against the dollar in 2020.
Last year, the sterling performance of the cedi is based on the decision taken by BOJ to go with the forward forex auction, which is a strategy to invite treasurers to bid for dollars ahead of time based on their forecast projections. But the issue is, will the central bank be committed to pumping this amount of dollars or forex onto the market? That is what we are looking at.
But the Bank of Ghana says with a strong dollar reserve position, that would help them intervene adequately to meet market demand, as well as its forward sale of dollars program to meet the demand of businesses that don't need dollars right now, but in the future. They believe that the cedi's position would not worsen or get into a very troubling state to reach 6 Ghana cedis, 45 pesos by the end of this year. The bank argues that some of these programs would deal with the activities of speculators and people who don't actually need dollars right now. The Bank of Ghana believes that they can depend on their reserves together with other monetary measures to strongly stabilize the Ghana cedi for this year. The central bank even believes that, based on some internal analysis, the local currency may even perform far better than what we witnessed in 2020. The central bank adds that they want to see these as mere projections, but assure businesses that that will not be the real situation on the ground going forward. The regulator argues that the same worst predictions were made about the Ghana cedi for last year, but actually ended posting one of its best performances against the dollar in recent times. The report also raised issues about our fiscal situation being the main cause of the cedi's depreciation for this year. But government, on the other hand, tells Joy Business they are now even in a better position to check their expenditure after an election and also having implemented most of the COVID-19 related expenditure for last year.
That's your business update. We've got a full bulletin at the top of the hour. Sports is up next.
Good afternoon, everyone. Welcome to the sports segment on Joy News. Today with me, Muftar Nabila Abdullah. As reported earlier this morning on the AM show, Right to Dream Academy and Egyptian billionaire Mohamed Mansour have reached an agreement that will help the iconic football institution expand and recruit more young players to hone their talents for the country. The investment in the Right to Dream is, we understand that about 100 million euros will be pumped into the academy. The Egyptian family, they will take the majority ownership of the academy. However, founder Tom Vernon will maintain his roles as the chief executive officer. Speaking about the investment, Mr. Mohamed Mansour, chairman and founder of the Man Capital, said, "I could not be prouder to be investing and partnering with the Tom Vernon Foundation and the Right to Dream Academy, who are inspirational for the life-changing work they undertake with talented boys and girls across Africa, Europe and the Americas. We have long taken a close interest in the work they are doing and are delighted to be announcing our partnership today." Not only are we a family of football fans, indeed, my uncle Mustafa Kamal Mansour even represented Egypt in the 1934 World Cup. But we are committed to supporting communities across Africa through our foundations and philanthropic activities. Tom Vinan, who continues in his role as the Chief Executive Officer of Right to Dream Group, said that for 20 years, Right to Dream has been using football as a platform for social change, bringing life-changing opportunities through sport and education for children and their communities. This partnership helps Right to Dream to move into the next stage of its global expansion, putting people and purpose at the center of football. With the support of Mansour family, we are creating a new standard of purpose-driven sports for clubs and players and building the leaders of tomorrow. Right to Dream is much noted to have produced some of the best talents in the country. One of them is Mohamed Kudus, who currently plays for Ajax. There's also Majida Shimero. There's so many players that Right to Dream has produced. Now let's do something on Kotoko and former Ghana international Emmanuel Ajimambedu. He wants the Porcupines to revive their under-20 team if they want to compete against the best locally and continentally. There's more in the following report. The FIFA Under-20 World Cup winner had a stint with the Porcupines. He believes the revival of the Kotoko Under-20 side would be essential if Kotoko wants to recapture their heydays.
You see, I think we need to revive the Under-20 of Asante Kotoko. So, looking at where I'm from, I think we can get talent from those areas to revive the Under-20. Teams like Kotoko is like Real Madrid. You can't go for the Under-20 players, but you need to put some to gain experience and know the culture and the character of Kotoko, so that you'll be having a good team each and every year. And I think the CEO is one of my good friends, and he have a thought about this kind of things. But right now there's a lot of pressure on him. He needs to concentrate on the senior side, get the results, get some players to just fix in. But looking at where I'm coming from, I can go around the villages, get some.
Ajimambedu, who recently retired from the senior national team, believes that it is quite early to tag Kotoko as title favourites, as the league is still young.
It's too early to say they can win the league. A new management, new players. We are having interim coach now, which we are not sure of what will happen tomorrow. You see, we are lacking two things in Kotoko now. Even in general football, when a team is not playing well and they are scoring, there's some confidence that, okay, well, the team is not playing well, but we are getting the goals and we are getting the point. It's one thing. When the team is not scoring and they are playing well, then you can have confidence that, oh, we need to work on the attacking midfielders, the strikers, and everybody, so that when the goals start coming, you get both. Now we are lacking both. The team is not playing well and we are not scoring. The last time, when was the last time you saw or see Kotoko winning 2-0? It was against only Liberty. For like a year, or I never see Kotoko winning 2-0, 1-0, 1-1. But I hope they will build on this 2-0 to gain the confidence back. Even if the game is not how we want it to flow, we need to start burying the goals. If the goals are not coming, we need to start playing well. But we are lacking both right now.
Kotoko is the record champions of the Ghana Premier League, winning the competition 23 times. That's all time will permit us here for sports on Joy News today with me, Muftau Nabila Ablai. Up next is Showbiz.
Our Charterhouse has opened entries for participation in the 22nd Vodafone Ghana Music Awards. In a press release, the organizers stated the artist management, record labels, producers, instrumentalists, music composers, and other stakeholders have until February 15 to submit their entries. Charterhouse revealed that works published in 2020 only to be submitted for nominations. Applicants, the statement added, are to submit their works online via the event's website.
Now, though, I've got to say a big thank you to all of you for joining us for the duration of the hour. Please stay with the Joy News channel for more. And, of course, stay with myjoyonline.com for all the latest headlines.